My topic is polypoidal choroidal vasculopathy in the young. Is it a new phenotype?
Dr. Anupam Singh, if you can be ready here.
So it was first described by Yanuzi in 1982, more commonly seen above 60 years of age, with a male is to female ratio of 1.4:1 in the Indian population. However, there's paucity of literature regarding its manifestation in the younger patients, which is largely limited to isolated case reports and case series, thus limiting our knowledge and understanding the current disease in the younger patients. So our aim is to study demographic features, clinical presentation and multimodal imaging characteristics of PCV in younger age group, and to see if this phenotype is different and compare the features with that over 50 years of age. So it's a retrospective observational study of 1100 diagnosed cases of PCV, and we found 56 patients aged less than 50 years. Patients who showed features of PCV such as elevated orangish nodules, submacular hemorrhage, serosanguinous PEDs, and lipid exudation underwent comprehensive ophthalmic evaluation and multimodal imaging. 8 patients were excluded from the study. 1 patient had a CNVM scar with active polypoidal lesions. 7 patients had dense submacular hemorrhage without characteristic ICG and OCT markers. Thus, 48 patients were eligible for us this study with a prevalence of 4.36%. The youngest patient was 32 years old, and there was a female preponderance with 66.7%. The mean visual acuity at presentation was 0.46 logMAR units, and the visual acuity at last presentation was 0.39 logMAR units, showing a p-value which is insignificant of 0.45. 60.41% of the patients had an hemorrhagic presentation. This is an example of 45-year-old female who had complaints of blurred vision since 4 days. We can see submacular hemorrhage. OCT shows subretinal sub-RP hemorrhage and a PED. The blood was displaced with TPA and gas. Vision had subsequently improved to 618 and N18. We can see a network in the peripapillary region with polypoidal lesions. Post-treatment, vision had improved. Another example, 48-year-old male who had come with submacular hemorrhage, and we can see subfoveal cluster of polypoidal lesions indicating the violent nature of the disease. 77% of the patients had the lesions subfoveally, 18% had the lesions in the peripapillary region. So 67.4 patients had predominantly polypoidal lesions. 32% of the patients had abnormal neovascular network, which was ending in polypoidal lesions. So another example of a 46-year-old who had complaints of metamorphopsia, presented with a small serous PED, managed conservatively. 1 year later, there was defective vision. Vision was 6.9 in 8. Fundus examination showed discrete yellowish lesions around the macula. On OCT, there was SMD, PED, and a shallow DLS. ICG shows a subfoveal network with polypoidal lesions. Post-treatment, we can see the regression of the polyps. So on ICG, in the hemorrhagic group, 13 patients had branching neovascular network. 21 patients had single to multiple polypoidal lesions. In the exudative group, 6 patients had neovascular network, whereas 13 patients showed single to cluster of polypoidal lesions. It was always associated with the pachychoroid, and so in this study, we highlighted the differences between younger and older age group. In the younger age group, there was a female preponderance with a male is to female ratio of 1:2, and the presentation was predominantly hemorrhagic. 67% of the patients presented with polypoidal lesions, and this explains the high incidence of submacular hemorrhage, since the polypoidal lesions tend to rupture and cause hemorrhage. Bilateral involvement was seen in 8 patients. Fellow eyes had macular scar in 5 patients, secondary to long-standing submacular hemorrhage or a serous macular detachment, which ultimately led to the formation of RP, atrophy, and scar. So to conclude, PCV can be seen in the very young, unlike ARMD, and the features differ from those seen in the elderly. This phenotype is characterized by hemorrhagic presentation. It's predominantly polypoidal in ICGA, located subfoveal, and is always associated with a thick choroid. It should be considered an important differential diagnosis in patients less than 50 years of age who are presenting with submacular hemorrhage or an exudative maculopathy. So the strength is, it is the only study till date which has looked into such a large series of patients, and it being a retrospective study is a limitation.
So what according to you, you have added to literature, like what some other sign you have added in your patients? Like
we didn't add any sign. sign, ma'am. We just noticed that these younger patients are presenting predominantly with a macular hemorrhage, and the lesions are predominantly polypoidal. So when they rupture, they cause massive hemorrhage in the fovea or the macular region, which can cause vision drop. If not treated at the earliest, they can cause vision drop.
Amongst the numbers that you're talking that this is the largest series, 48 patients, you must be evaluating your past records. So you can give us a data where you say that so many thousands of posterior pole lesions, how many of them were like this?
I didn't get you, sir.
No, so
What percentage of
patients
who present with submacular hemorrhage or clinically?
Yeah, like
how
almost
many?
60% of the patients had hemorrhagic presentation.
No. Out of total,
out of the total, let's say
100 patients present with submacular hemorrhage, according to you, how many should be suspected? What is the incidence of PCV in that?
CNVM, you see all these patients who develop CNVMs, bleeds, everything posterior pole. Now in your case series, how many of them were only this and not others? Like you could differentiate from each other?
Yes, sir. Like once we've displaced the blood, we repeated ICG and DFA, and in patients who had these polypoidal lesions or the type 1 MNV network, we had included them as PCV.
Okay.
Like if we didn't see any network, if it was predominantly CNVM, we had excluded those cases.
No, the point here is that you have a sampling bias. Because here you are taking this cohort from the patients who are already diagnosed PCV. From there you are taking these patients who are young.
Yes.
You don't have the entire population of young patients, and then you have seen the characteristics in these. So
no.
that is what they are asking.
Yeah,
How many of
I've
those
been seeing
patients
Dr.
will-
Girdhar following this up and presenting all this. So is there any change in the statistics, in the demographic change? Patients are coming from a different, because why a particular area is showing so many patients? No idea.
But it's a very excellent comparison.